A new type of weight loss drugs called GLP-1 agonists are taking the nation by storm in the fight against obesity and type 2 diabetes.
And in this week's Wellness Wednesday, I investigated how they work and what you might want to consider before getting that prescription.
Type 2 diabetes?
Discover the Ozempic Trizone.
You've seen the commercials, and you probably know a few people already taking them. GLP-1 agonists include semaglutides like Ozempic and Wegovy, and tirzepatides like Mounjaro and Zepbound.
All four of the medications have this GLP-1 hormone, which is produced in the gut. So it's similar to what our body produces already. It helps the body produce more insulin, release insulin. But it also impacts satiety, so you more slowly digest food. You're full a little bit longer.
Registered dietitian and Shasta College professor Joanne Tippin says these drugs can save lives.
What are some of the takeaways about these drugs and how they're affecting our health as a nation?
I have seen some great results. I haven't seen some of the side effects that I know are out there. I'm seeing people just improve in terms of blood sugars, weight loss. I do have some, and there's more research to come out on chronic kidney disease, but I've seen really good kidney recovery.
Do we take the risk of, as soon as somebody goes off of it, they haven't set any habits in place. They're just trusting their hormones to keep them from wanting to overeat. And then if they stop taking it, are they right back where they started?
To me, I think about these medications, they're just a great way to combat what's happening in our highly palatable foods today. It's hard not to eat a lot when food tastes as good as it does, and it's everywhere.
Tippin says this isn't a quick fix. People are going to need to stay on these medications for the long haul.
As soon as they come off, some of the research is showing us that within a year, they're going to gain back 2/3 of their weight.
Even for those who stick with a diet plan.
So once you take that GLP away from them, help them get to that weight, their leptin levels are down. Their hunger is going to come back. Their body is going to fight to get back to that weight.
She says problems that come up often are linked to poor diet and taking too much of the drug too fast.
Some of the side effects that we see more commonly might be GI upset. And so if they're slowly increasing their dose, they have less chances of that.
She says eating slowly helps prevent problems. But some users complain they don't feel like themselves.
I used to be a really positive, bubbly, sunshine person. And over the last year and a half, I've kind of lost that.
Experts say GLP-1's effect on mood needs more research.
There has not been any link directly with the drug and any known personality disorder or any known psychiatric condition. But it would not be impossible to see a range of responses, including a change in personality.
A study from the Journal of American Medical Association found that for every 1,000 patients who used the drug, some had moderate to severe stomach problems, including pancreatitis and stomach paralysis.
Each one of these complications could be serious enough that it could be life-threatening.
In response, the manufacturer Novo Nordisk said in part it stands behind the safety and efficacy of all our medications. Other people are seeing additional positive side effects they didn't expect. Megan Johnston started taking a semaglutide last year and says it's helped her cut back on drinking alcohol.
It was definitely that I wanted to lose weight. But I thought if I can drink less, even better.
Several clinical trials are currently underway to look at whether semaglutide reduces craving for alcohol and if it's safe to use it that way. For now, Tippin says if you do go on the drugs, make sure it is just one part of your lifestyle change.
Really looking at the benefits of what a whole food, plant-based diet perhaps can provide you. What are the benefits of exercise outside of just weight? So sometimes I think with nutrition, we get caught up on that scale and the number on the scale. And there's so many other beneficial things that healthy foods do for you.
In one clinical trial, 86% of participants lost at least 5% and 70% lost 10% or more of their total body weight.